Okay, so we want to look at the muscles of facial expression. So these muscles all originate on bone, but they're going to insert on the skin nearby, so that whenever we contract them, we're changing the way our skin looks, which creates different types of facial expressions. So the first muscle that we're going to look at is the occipitofrontalis. So the occipital part, you have a small little head of this muscle on the occipital region of the skull, but the majority of it is on your forehead. And the goal of this muscle is simply to wrinkle your forehead up. Now they are connected to each other by a long tendinous band called the epicranial aponeurosis. It's just basically a tendon. Next we have the nasalis, which helps us to flare our nostrils, right there on the nose. The orbicularis oculi, so orbicularis means round, and it's referring to the eye with oculi. So orbicularis oculi. We also have the orbicularis oris that runs around the mouth. The buccinator, or buccinator, some folks like to call it that. You can see on the deep dissection side of this skull, the buccinator here, but on the superficial side it's tucked in a little deeper to some other muscles, and this is basically your whistler. Just lets you whistle, compress your cheeks. Then you have your levator. If you think about a levator, an elevator, it picks up. So anytime you're looking for a muscle with a levator in it, it's going to be above whatever else is in the name. So this one that we're looking for now is the levator labii superioris. So that means it's going to elevate the upper lip or the superior lip. So this little muscle here is the levator labii superioris. Zygomaticus major and minor. Zygomaticus refers to the origin point. So both of these originate on the zygomatic bone. Zygomaticus major is going to go to the corner of the mouth and help you to smile. Zygomaticus minor is going to go more on the upper portion of the lip. Basically, if you wanted to do like an Elvis lip curl, this would be the one that would do that for you. If you want to look indifferent, you would contract your risorius, which basically goes from the corner of the mouth and pulls it straight back towards the ear. The depressor, so we're going to look for a couple of depressor, basically the opposite of levators. They're going to be below whatever it is that they're going to be contracting. So we're going to be looking for the depressor labii inferioris. So it's going to depress or pull down the lower lip. So that's going to be this one here, the depressor labii inferioris. The depressor anguli oris also depresses the mouth, but it's specifically at the angle or corner of the mouth. So the depressor labii inferioris and the depressor anguli oris. The last set of muscles that we look at are our mentalis. It just helps us to contract and change the shape of our chin a little bit. Now we also are going to look at muscles of mastication, which means chewing. There are really 4 of these, but we're only going to make you responsible for 2 of them. Both of these muscles control the temporomandibular joint movement, so between the mandible and the temporal bone. So the first of those is our temporalis in our temporal region. The other is the masseter. So this one has fibers that run superior to inferior from the zygomatic bone down to the mandible.